3:21 on Maryland's News Now. I'm John Patty. Following the January double murder-suicide at the Columbia Mall, Howard County Executive Ken Ulman is proposing hundreds of millions of dollars in funding for mental health programs and awareness. WBAL's Ann Kramer spoke with him about his proposals that include working with medical professionals and police.
Behavioral health, mental health has always been a priority of mine and of our administration, but after the devastation at the mall shooting, in studying that case and studying the fact that we had an individual who knew he was mentally ill but did not know where to turn for resources and was dealing with the mental illness stigma of not being able to tell his family members, I tasked my senior staff, my policy folks, to take a look at where the gaps are in service delivery in Howard County in the continuum of care, and also let's work to break down the stigma. So we're doing a number of things. One is we are starting a program of mental health first aid training, where we're going to train folks in our school systems and throughout organizations in the public and private sectors that deal with children, especially to understand early signs of mental illness. We are also adding a number of positions in the Mental Health Authority. We are going to create a full-time position to work directly with Howard County General Hospital, that when someone receives an emergency petition, they're being evaluated at the hospital. When they are released, we want to make sure that that person and their family is connected into resources that exist that can help them. We created a full-time position, a police officer position, to work with the Mental Health Authority staff to make sure that we are taking a deeper look at repeated calls for service that involve mental illness, mental health issues, and we're creating a second full-time mobile crisis team. A team, we have one, now we'll have a second one, a team of mental health professionals that go out to public safety calls that we know have a mental illness component, so we can get folks services on the spot. And lastly, we put in some funding to begin a community-wide behavioral health analysis, so we can do a further look at those gaps that exist. We're making some progress in the budget now, but we also want to take a deeper look community-wide at what we need to do to continue to do our best to make sure folks have support they need in this tough issue.
Aside from the Columbia Mall shooting, and I know you mentioned that this is mental health awareness and mental health funding has been a big part of your plans and proponents you've been as county executive, but have you seen more cases of people suffering from this, maybe not getting the help that they need?
Yes. In fact, last year's budget, we created a full-time position in the Mental Health Authority assigned to the police department to look at those cases. I mean, we can look in any community in this country, and Howard County is no different, and you can see calls for service, 911 calls, where there's a repeated call, and often a repeated component of that, which is an emergency petition to be evaluated for a commitment proceeding. You can see where there are a number of calls that are into a specific address repeatedly. And we know that there are issues, whether it's somebody not taking their medication, whether it's somebody who just isn't getting the support they need. We're never going to be able to be perfect. We're never going to be able to solve every challenge. But we do know that by better coordinating resources and filling in these gaps, we can do a better job of getting folks the treatment that they need, which avoids the potential violence that can come when folks do not get the treatment they need.
Howard County Executive Ken Ulman, thank you for joining us on Maryland's News Now. We appreciate it.
Thank you, Ann. Take care.